Hi everyone, Sean here with the MassSupport Network, here with your COVID-19 update for Friday, December 11th, 2020. Trends keep on going up, reaching new highs as worldwide we saw 4.5 million new cases in the last week, which is about 400,000 more than it was the week before. Here in the United States, we saw 1.4 million new cases, about 200,000 more than the week before. And here in Massachusetts, we saw about 34,000 additional cases, which is 14,000 above the week before. So things continuing to ramp up. In terms of deaths, 79,000 worldwide, which is about 9,000 more than the week before. 16,000 in the United States, which is 4,000 more than the week before. And here in Massachusetts, 335 people died of COVID-19 in the last week, which is almost 50% higher than it was the week before, with 115 additional cases over the last week. And just looking at everything graphically, the 7-day averages continue to be record highs. Our hospitalizations are still the highest they've ever been. Daily cases, we are consistently seeing over 200,000 new cases a day for the last couple of days. Any day but a Monday or Sunday is going to have those numbers recently. And deaths have reached new highs with over 3,000 deaths per day for the last 2 days. In terms of where this is spreading, there are now 7 states seeing more than 10,000 new cases per day, with California seeing over 20,000. And when we look at this by population, we see that it's a pretty solid band across the country here, with Rhode Island actually in the lead, if you can call it a lead, and just most states seeing between 500 and 1,000 cases per million people per day recently. These are 7-day averages as well, not a 1-day total. So these are more indicative and less prone to the changes of reporting from day to day. Look at hospitalizations. Everything is still trending up, except in the Midwest, where it does seem to have plateaued or possibly even be trending downwards. Let's keep our fingers crossed on that. But the South has, in fact, passed where it was at the high peak in the summer. There's new heights there. The only area that has not reached a new high during this December-November surge is the Northeast, and that's really just because of how high things were in the spring. And if this trend keeps up, we might pass that again sometime over the winter. Let's hopefully we can turn around before then. When we look at deaths, we have reached new heights with deaths there, passing the numbers in the spring. Now, there may still be some backlog death counts in those numbers. Yesterday and the day before, each getting over 3,000 deaths. However, there were probably plenty of backlog deaths in those high points in May as well. So it probably balances out there. We're currently, as being reported, getting more deaths per day than September 11th or Pearl Harbor or any of these other major mass casualty events that stick so well in our memories. But moving on to developments, there is some exciting news. Yesterday, an FDA panel voted 17-4 to recommend the approval of the Pfizer vaccine. So we could see that as early as this weekend being approved, and that could mean that the first vaccinations in America could start as early as possibly next week, which is very exciting. Canada has also approved the vaccine and will start rollout there as well. However, one important thing to note is that there have been 2 recipients of the Pfizer vaccine in the UK, who of course started vaccination on Tuesday, who had significant allergic reactions to the vaccine potentially, or following vaccination is a better way to say it. Now, these were healthcare workers who had histories of significant allergies such that they carried EpiPens with them. So it does sound like something that's going to be pretty rare, if it is even a general vaccine issue. I know that they're healthcare workers because healthcare workers are especially prone to latex allergies. and there's potential risk that perhaps it's not the vaccine itself, but perhaps something from a syringe or vaccine container that contains latex may have triggered a vaccine. There has been some caution about recommending the vaccine to people with severe allergies as a result, but we also kind of want to make sure that people are not scared off by this because it is extraordinarily rare. Thousands of people have gotten the vaccine, and we've only have 2 reports so far of this level of allergic reaction. So it is important that people still get their vaccines in order to curb the spread. Also, ICU beds are nearly full in much of the country. 1/3 of Americans live in areas where there are 15% or fewer ICU beds available, and 1 in 10 Americans live in areas where there are fewer than 5% of the ICU capacity is open or that's completely full. And that does include northeastern Massachusetts, where ICU capacity is full right now. Fortunately, Massachusetts is not a big geographic area, so there are other ICUs in the Metro Boston or Central Massachusetts area people can go to, but in some areas where it's very rural parts of the country, there just aren't ICU beds available anymore. So we do get some more data on some of the non-Western vaccine projects. China reported that its vaccine, its first vaccine, there are several Chinese vaccines in works, is 86% effective, which is good. It means more places in the world are going to get the vaccine. Also, the Chinese vaccine in question, I believe this is the one from Sinopharm, uses a more traditional heat-killed virus approach that means that it's much more shelf stable for areas of the world where the intense cooling needed for the mRNA vaccines is not feasible. And this vaccine has received approval for use in the United Arab Emirates, where it was in trials. Russia has also reported their vaccine has a similar effectiveness to the Pfizer Moderna vaccines, but the details on that are still a little sketchy. Also, Johnson & Johnson has reduced the trial participant number for its vaccine. They were slated to enroll 60,000 people, but they're actually going to cap it at 40,000. And part of the reason for that is there's just so much transmission now in the country that you don't need to enroll that many people to get the data. Part of the way that the vaccine trials work is that you give half the participants the vaccine and half placebo, and you wait for people to get sick and compare the numbers in the 2 groups. And in most vaccine testings, you need massive numbers because it was rare to get whatever virus or disease that you were trying to vaccinate against. But in this case, where we're seeing 1.4 million new cases per week, we don't actually need that many people enrolled to get these numbers that we need, which is really disturbing. Also, good to note that Johnson & Johnson is the first vaccine project in trials that only needs 1 dose, not 2 like all the others. So that is something that's very important to get the data on that when we can. For the sources, you can go to the usual places for our numbers, COVID tracking project for all those lovely graphs, New York Times for there's the raw case counts, and mass.gov for Massachusetts specific information. And for more from the MassSupport Network, you can find us on our website or on social media. Remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.